This is Peter Endo, and Dr. Carr asked me to review this complicated case with you. This case was referred by a periodontist knowing that there was a perio and endo component. Here is the pre op x ray showing poor crown to root ratio, large apical finding. Here is also a CT scan showing large lingual fenestration. The tooth tested non responsive to CO2 ice. Please note size and location of the bone loss. She had no complaints. She had a history of pain and swelling that went away after taking Augmentin. Perio mobility was +2. Bite, percussion, palpation were normal. So we decided to perform root canal even with the thought that this could be more perio than endo. We knew this was a guarded case. First visit was treated with gentle wave and BC sealer. Recall 6 months later showed that there maybe have been some bone regeneration. However, later patient returned saying that she had some lingual swelling and had difficult time placing her removable partial denture back on. There was also a sinus tract which was traced, confirming the apical finding. So we retreated it and we used conventional instrumentation and Kerr sealer. Patient then returned with lingual swelling and could not use her removable partial denture. At that point, we decided it was time to remove the tooth.
I received the tooth intact in a neutral buffered formalin. I took a few high-resolution photographs of the root, incisal restoration, and terminus. No crown or root fracture of any kind was detected. We took buccolingual and mesial-distal radiographs, and again, no fractures were observed. The tooth was split sagittally into two halves as described in prior tutorials. The case looked extremely well obturated. After photographs were taken of both halves, we teased the gutta percha compaction out of the canal intact and then mounted everything on SEM stubs and sputter coated with gold palladium to a thickness of 10 nanometers for observation on a field emission scanning electron microscope. We examined a total of 30 areas and photographed 7 of those. In none of the areas were any microbial biofilms observed. Although most areas were coated with sealer, there were some areas where the naked dentinal wall could be observed. Area 1 is fairly typical when you see a very limited smear layer, no pre-dentin to speak of, and only a slightly mineralized mineralization front. A closer examination of the tubules reveals that the precipitation of the non-collagenous proteins of the peritubular dentin suggests that the peritubular dentin is partially intact, as none of the collagenous nature of the tubule is evident, as it is with greater demineralization of the tubule. The extraction of the proteoglycan and glycosaminoglycans of the peritubular dentin by the dehydration and processing procedures produces a fairly typical picture of the mineralization front. In area 2, you can see how the demineralization of the predentin structure creates layered remnants of dentin, reminiscent of the plate-like structure as dentin is mineralized originally. In area 3, there is one area particularly interesting to those interested in learning how to distinguish biofilms from demineralizing dentin. Although most of this is sealer, there are areas of exposed naked dentinal wall. In those areas, there appears to be a candida-like morphotypes, and it would be easy to make that call. But I do not believe there are candida organisms here. This is how extensive demineralization of dentin can appear as the predentin is being completely demineralized. Could I be wrong about this? Of course, which is what makes this so difficult. Later on, in some other cases, we will examine yeast morphotypes and develop a better picture of what those communities should look like. In area 7 at the root terminus, again you see partial demineralization of the collagen substructure and how easy it is to mistake biofilm morphotypes for demineralizing dentin. Only by observing many demineralization cases and biofilms can one gain a higher level of confidence in the call. I want to thank Peter Endo for submitting this case. It is very, as it is very interesting on many different levels.